Alright, so there's just one on and off switch in the machine, which is right here.
Okay.
Once you turn the machine on, this is the first screen that you'll get into. Okay. And the username and password is lipaview. If you forget it, it's right here.
I hope I spell it right.
Submit. Alright, so now you're just going to enter the patient information, and as you might have noticed, there's nothing in the TV over here right now. That's normal. That's for the HIPAA reason, okay? We don't want the patient to see other patient's information, that's why.
Makes sense. If she's already in here, do you
then just touch on the patient name, capture new images.
This is a new scan, but the same patient, same name.
Yep. And then let's start from the right eye. So just take the camera to the right eye, view OD. And then we'll just ask the patient to put their chin on the chin rest, forehead right against the bar. And just like any other test, you want this black line to be lined with their eye.
Okay.
Seems to be pretty good.
Yeah.
Just in case if it is not, then you can always move it using, roll the wheel over here.
Okay.
That's the chin adjuster. Yeah. Alright, wherever you touch it in the screen, that's going to be the center of the screen.
Okay.
So start by touching somewhere close to the pupil.
Okay. Oh, okay, got it.
Okay. And so that's the lipid layer. That's what you are looking at. And always make sure you see a little bit of the lower lid as well.
Okay.
And if you have to make a smaller step, use the step button. But if you have to make a bigger move, you can always click over here. That's going to take it all the way up and down. Okay.
Yeah.
Same thing with the left and right button as well.
Yep.
So step it down a little more to see a little bit of the lower lid. A little more and a little more. And the reason to see the lower lid is so that we'll be able to check the blinking. Okay? Getting crisp right there. Down. Okay?
Yeah.
Same thing with the left and right button as well.
Yep.
So step it down a little more to see a little bit of the lower lid. A little more and a little more.
Great.
And don't get confused with this green rectangle box over here. The lipid layer doesn't necessarily have to be in the box. It's there just for the reference.
Okay.
You always want to see the lipid layer right in the center and a little bit of the lower lid.
Okay.
So bring that a little more in the center. That looks good.
Okay.
And now you just want to focus on that a little bit more. Try using the focus bar up and down.
Okay.
Make it down, Maybe one more time. And go up one time, and then I think that's the right spot. You see it's getting crisp right there.
Yeah.
Alright, and then we'll tell the patient to look at the orange light.
Okay.
Blink normal. All the other tests that we do in the office, the patient is so much used to keep on staring.
Right.
So that's why we want to tell the patient, just look at the light, that's the fixation light. But again, you don't have to keep on fixating on that light.
Okay.
You can blink whenever you need to blink, okay?
Yeah.
Alright, start capture. And blink please. Blink again. And blink again. And now we can move to the left eye once that stops. Touch view OS. Touch view OS again. It hasn't moved to the left eye. Alright. Again, start by touching at the pupil. Now you can step down it a little bit more so that we can see a little more of the lower lid. That looks good. And now use the focus bar. Right there looks good.
Okay.
Usually when you do this few times, you will know that whether the lipid layer is in focus or not. The reason to look at the reflection of those lashes is, since this is the reflection as well, the lipid layer is the reflection as well, so both of them are in the same place. So once the reflection comes in focus, the lipid layer is coming in focus as well. But once you do this like 10 or 15 times, you will know when it's blurry or when it's in focus. Alright, hit the start capture button. And again, the capture time is 20 seconds. So the only instruction that you'll be giving to the patient would be to look at that light, blink normal, blink whenever you need to blink. But again, if the patient doesn't blink at all, like that was what was happening in the right eye, you want to remind the patient to blink every 4 or 5 seconds, because we want at least few blinks in the 20 second of time. Because if the patient doesn't blink at all, then there is no movement of the lipid. Okay,
Right.
so that's why we remind the patient to blink. All right, now hit the save all, continue.
So these here, would you check that off if you?
Sure, you can just put a check mark on the normal
Okay,
blink,
that's
but
all it's for. Or
it
if you
depends,
made 'em.
like
Okay.
if you're going to do a normal versus forced or not. So at this time, you can just look at the speed, talk to the patient. If they use drop, just ask them what kind of drop are they using, how many times are they using, how long have they been using it, all of those information.
Yeah.
And now hit the analyze images, and once you get to this screen, then you can start explaining the patient about the 3 layers in the tear film, and again about the aqueous, mucin, lipid layer.
Yep.
And we're measuring the thickness of the lipid layer. Average number is 72, right? And as you can see, it's giving us few other number, max, min, standard deviation. So max and min are indexed by the blue and red triangle. We're capturing the video for 20 seconds, and in every 1 second we're capturing 30 frames. So in that 20 second we're capturing 600 frames. Okay, and what it's doing is, when doing the analysis, like I was saying before, it's taking every single point off of here and then comparing that into the color scale and giving us the reading based on that average. That's how it's giving us the standard deviation as well, using the standard deviation formula, like the variance between the max and the min. And so that's the standard deviation, that's the average. So this is just plotting average, the black line, and blue and red are plotting min and max in reference to the standard deviation. And this triangle over here, you'll find it over here. So that's telling us that in that 600 frame, the lowest ICU value was 53, and that was at this time, and the max was 105, which was over here.
So the triangle in red or maroon is the average.
Average is the 72.
72, that's what.
Yeah,
that's
so
what-
this black line is plotting the average.
Right. But there's that little triangle on its side.
And this one is
in the middle.
the index for the max.
Okay, so that's the index for the max, and that's the index for
That's
the
for the index for min, yeah.
So at that point, it was only 53.
That's
lipid
correct.
Got
Yeah,
layers.
yeah.
Gotcha.
And then we also have something called C factor that we call confidence factor or conformance factor. So that's telling us how reliable the test was. Okay. And we are looking for some number above 70. Anytime we get below 70, then we do want to do the test one more time. And the reason why it will get below 70 is if the patient is tearing a lot, if the patient is moving the head a lot, if the patient has used some artificial eye drop, ointment,
So C factor over 70.
over 70, yeah. And again, what this C factor is telling us is, like when doing the analysis for the data, it's checking how much of color over here actually matched the color palette over here. 90% of the color that were found here actually matched here. Okay, so that's the reliability factor. And if below 70, do it one more time. But again, at some time, you'll know that you'll never get it above 70. That's because there are few patients who are very, very sensitive to light. They can't keep their eyes open even for a few seconds. They keep on blinking, they keep on tearing. And again, if somebody has used some artificial drops or ointment, after you do this a few more times, you'll see that with the artificial drop and ointment, there will be colors over here, which looks kind of red, pink, or something that's not present in this color chart. So that just throws off the reading, and we'll get the number below 70. Okay, and also if we're doing this over the contact lens, the number will be below 70 most of the time.
On the standard deviation, is that number significant? In other words, does it matter if the standard deviation?
It's just giving you an extra piece of data. That's the variance between the lipid layer in that 20-second of time.
Okay.
So
So, is there use to that? Do you have?
no, we haven't used that. No.
So that was not working.
Usually what I've seen is if the average is 72, so that's kind of normal kind of average, so that's why the standard deviation is 7.
Okay.
There's a good variation in min and the max, but let's say if the patient is 25 or 30
Yeah.
in the average, then the standard deviation would be maybe 2 or 3 because there would not be much of a variation.
Sure. Yeah.
Also, the next piece of information that you can get by looking at this graph would be, so this is the blink that he's making, okay? This, and this graph is plotting the average, okay? And like you can see over here, right after the blink, there is an increase in the lipid. It decreased again, then it kind of stayed stable, okay? In some patient, what I've seen is, it increases and then drops down drastically. So that's telling us that the lipid is not a quality oil. I mean, you can see the different kind of colors over here, but again, it dissipates in just a second. Okay, like let's just recap the video here.
The phospholipid
Yeah.
surfactant.
You can see the reason why there is a hike in the graph over here, right?
Yellows,
Yep.
browns.
Going back, you made a blink, and whenever you're making a blink, the upper lid is pulling up all the lipid from the lower lid. If you make a complete blink, then you'll get a fresh new oil pumped by the meibomian gland. But still, even if you don't make a complete blink, those oil will be pulled up. Okay, so just there is an increase doesn't mean that you made a complete blink. You might be just pulling up the same old oil, but that's a blink. And right after that, that's the increase. That's the oil that you're pulling up. All right, so now let's go back and then check the blinking and that.
You can just tap it, right?
Yeah,
You said?
and then play it by every frame using the step button.
Okay.
So that was a partial blink.
Those are partial blink, yeah.
That is inherited.
You see what I'm saying, right? So there's an increase, but still that's not a complete blink. You're just pulling up the oil, but that's not new oil. All right, so that's not complete either.
Gosh, just don't even think about that.
Right, so-
Exxon Valdez.
That's where the bigger screen, the bigger TV comes into play. It just
Yeah,
makes a
I
lot of sense to the patient when they see it in a big screen. Now we're going to capture one more video on her, okay?
Okay.
Since you're on the same patient, you can always go to the capture image, that tab over there.
Okay.
So just press on the tab and we'll have you put your chin back in the chin rest
Okay.
again.
Want me to blink hard or no?
Yeah, put your chin there first
Okay,
and then
fine.
we'll instruct you. Then we're just going to ask you to close your eyes in few seconds. All right, so now we're just going to count up to maybe 10 or 15 seconds, okay? 2, 3, 5, 7, 9, 11, 13, and 15. So you can open your eye. Did you squeeze very hard or very?
Tried to.
All right.
We don't believe it.
So we didn't check her blink on that eye, did we?
We just had the data for one eye on the previous video. Once you do the analysis, it's automatically saved in the computer. So to print the report, you just need to go to Print and Save tab, hit Print Report, and then hit the Print button again.
See, he has. So therefore.
And if you have to go back and enter a new patient, then you can just go back to the patient record and start entering the new patient.